Welcome to Season 4 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Commissioner of Health in Baltimore City. Our goal is to bring scientific evidence and experience to current topics in public health through engaging interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, Stephanie Desmond talks with Craig Pollock from Johns Hopkins and Kate Leifheit of UCLA about evictions during the pandemic and their link to a rise in COVID-19 cases. They also discuss the reinstatement of a federal eviction moratorium and what the future looks like for millions of renters behind on $23 billion in rent in the United States. Let's listen.
Craig Pollock and Kate Leifheit, thanks so much for joining me. Today, we want to talk about evictions and COVID. There's been a lot in the news in recent days about this. I'd like to talk about a study you did recently about how evictions are associated with COVID cases. Kate, could you start?
Sure. So this is a study that was published in the American Journal of Epidemiology a couple weeks ago. And we found, looking at a period in summer 2020, so this is last summer, when most of the eviction protections were happening at the state level. And we found that when states ended their eviction moratoriums, we saw 430,000 more COVID cases and over 10,000 more deaths during that period from March to September 2020 than we would have if states had kept their moratoriums in place.
And why do you think that is, Craig?
So I think there's many reasons to think that eviction moratoriums are linked with health and particularly COVID transmission. So when people are evicted, they're forced out of their house, often moving into congregate settings or with friends and family members. Some, unfortunately, need to move to unsheltered places. All of these things make it really, really hard to try to isolate yourself from COVID or remain quarantined for people that have potentially been exposed. So potentially increasing the risk for themselves and also for the community due to the overcrowding that sometimes happens as a result.
So you kind of sort of had a natural experiment going on and did your research on that, Kate?
Right, that's right. So there were 44 states in the U.S. that had moratoriums. 27 of them lifted their moratoriums or allowed these protections to expire during our study period. So we were able to compare those 27 states to the 17 states that kept their moratoriums in place. And we also controlled for things like mask mandates, testing rates, stay-at-home orders, and school closures, things that we know are really important to COVID transmission, so that we were making sort of a more fair comparison between those two types of states.
Mm-hmm. And if I recall from reading your study, it was more than 4,400 excess deaths in Texas alone.
Right. So some of the largest states like Texas account for a lot of the deaths. Texas is both a really populous state and the state that allowed its moratorium to expire early. So that's more time over the summer with no protection. That's more evictions and more cases tied to those evictions.
Mm-hmm. So I know that a federal moratorium expired and then maybe it's back and some states are going to have moratoriums again and some states aren't, Craig. So how should we be thinking about this and how large is this problem?
Right. So on July 31st, the national eviction moratorium that was issued by the Centers for Disease Control lapsed. It was restated somewhat differently just a few days later at the beginning of August. And basically, the new CDC eviction moratorium applies to certain areas that have higher levels of COVID transmission, primarily due to the Delta variant. And these eviction moratoriums are designed to try, again, to prevent the spread of COVID-19. During that time period, there's also a concerted effort to try to get federal aid out the door so that to try to help renters remain living in their homes. This is an enormous problem. Right now, we estimate that something along the lines of 1 in 5 renters are behind on their rent. Many are really worried that they're not going to be able to make their rent in the future and going to be evicted from their homes. So the public health ramifications are really enormous.
Mm-hmm. I'd like to hear more about those, Craig.
So we know that there are many other ramifications of eviction across the lifespan, from young children, pregnant women, to adults, that there are really important ramifications. And I'll let Kate speak to some of them because she's done some of the important studies in this space.
Right. So Craig and I worked together on my doctoral dissertation with a lot of other lovely folks from Hopkins. And some of what we found, we were looking at the association between evictions and different child health outcomes. So we found that if a mom is evicted during pregnancy, she's much more likely to give birth to a baby that's preterm or low birth weight. If kids are evicted in early childhood, they're more likely to become food insecure, fall behind developmentally. My colleague Gabe Schwartz has done research that looks at the reverse relationship. So also if you're born low birth weight, you're more likely to get evicted into the future. So we start to see this kind of cyclical relationship where eviction can cause poor health, and then poor health in turn causes eviction and housing instability. So it's a cycle that can be really damaging with long-term implications for health, and one that we should do everything we can to interrupt.
Mm-hmm.
I also want to point out the tremendous stress that people are under during this process. These can be lengthy processes by which people fall behind on their rent and get evicted. And just there's a tremendous amount of mental toll that's taken here.
Mm-hmm. You mentioned 1 in 5 renters are behind. I think the figure is $23 billion is estimated in how much back rent is owed. People aren't going to be able to make that up very easily. So, and landlords have bills to pay as well. So, Kate, how do we reconcile the two?
So in winter of 2021, Congress authorized over $40 billion in relief money for landlords and renters to help settle these massive debts that they've accumulated. It's been slow to roll out, though. So that's a problem. As of the end of June, only 10% of that money had made it into the hands of renters and landlords that need it. So the Biden administration is putting pressure on states and localities to ramp up these programs and get that money out the door fast, so that hopefully it gets to the people that need it before this extended moratorium expires. But it's really important that it does.
Mm-hmm. So this moratorium that was recently put back in place by the Biden administration and CDC, there have been challenges in court to previous extensions of moratorium. So how do we know this is even going to last, Craig?
I don't think we do. I think we need to expect that there will continue to be challenges to executive orders trying to extend this moratorium. And so really we're in a race for time where it's so important for states to get the money out to renters who are behind on the rent, who need it to avoid eviction.
Are we seeing a red state, blue state when it comes to this money getting out the door, Kate?
I don't think so necessarily. I think the problem really is sort of a universal one, which is that no states really had robust rent relief programs that already existed. So states are having to build these programs from the ground up, which is just a slow process. So especially local governments, there are some examples of cities that have been able to get out, 60% of the money. I think just there are sort of lessons learned that have allowed them to move faster than some of these big state agencies. But I think it's just taking time.
Mm-hmm. So eventually, God willing soon, we will no longer be in the middle of a COVID pandemic. Craig, how do we get back to sort of an equilibrium that works for people?
I would make the case that we weren't at an equilibrium that worked for people before the pandemic, that there was tremendous housing precarity. In 2016, there were about 3.6 million evictions. That's way too many. And I think it speaks to the fact that housing costs were too high relative to household income. And so I think we need to start thinking about what are the policies and protections that can be put in place that are able to help protect renters while also making sure that the landlords aren't left holding the bag. And so we're seeing a lot of movement and interest in, for example, trying to increase the amount of federal rental assistance that's available. We know roughly 20 to 25% of people that are eligible for housing assistance today actually receive it, that it's not an entitlement program like so many of our other social safety net programs. And so working to, for example, expand the supply of housing assistance is really critical to try to get not back to where we were before, but to a new place where hopefully more people are able to afford their housing and in turn try to support their health as well.
And Kate, I'll give you the last word. What do you want to see happen?
It would be great to see some of this emergency rental assistance become routine rental assistance. The problem is that these kinds of programs are waiting till people are on the brink of losing their housing, right? So like Craig is saying, the problem is really that housing is too unaffordable, which means we need to think about ways to either subsidize housing, give people vouchers so it's more affordable, build more public housing, or we need to increase the supply. I guess I should say, and we need to increase the supply of housing. So building more affordable housing, changing zoning rules so that people can build more dense housing in urban areas. I think we need to tackle this problem from a lot of different angles because it's a big problem that affects millions of Americans.
Craig Pollack, Kate Leifheit, thanks so much for joining me.
Thank you.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.